Hello everyone, welcome back. My name is Dr. Rosa and you can call me Dr. Rose. Today we're going to be talking about how to transition from college to medical school and what can you expect. So let's get to it. So just to give you a starting point, what we're going to dive into this video is that period after you've taken and passed your MCAT, gone through interviews, and been accepted into medical school. Now, what I want to point out beforehand is that there is no general or universal advice that should be or can be followed, because all medical schools in the US, Puerto Rico, Mexico, and the Caribbean have their particular small nuances and particularities that make them different. However, there is a general trend in the medical school curriculum, and that is that in a 4-year medical school, the first 2 years tend to be purely academic, whereas the latter 2 years tend to be a mix between clinical and academic. What we're going to be discussing in this video is how to prepare for those first 2 years. So similar to college, you will follow a very structured program of classes, usually from 7 or 8 in the morning to 4 or 5 in the afternoon. It tends to be Monday through Friday. However, the main difference is the academic workload, which is much heavier and much more intense than what you usually would be accustomed in college. So the first thing you need to know is, what would I be learning in those first 2 years? Well, there's biochem. Biochem essentially is how the body works on a chemistry level. Anatomy. Anatomy essentially is getting to know and understand the body to the naked eye and how it's arranged. Then there's histology, which is, as you would say, a microscopic anatomy. In other words, you will be understanding and learning how to identify different structures, organs, cells, etc. through the lens of a microscope. Then we have embryology, which is from an embryo, how things essentially come to be, how things move, how things form overall into a normal human being. Then we have physiology. Physiology is essentially how the body works and how each organ system not only works, but how each organ system works amongst themselves as well. Then we have immunology. Immunology is essentially how the body defends itself, how the immune system works, and what constitutes the immune system and its various cells. Which then brings me to microbiology. Microbiology essentially is learning the most relevant microorganisms that can infect the body and cause harm to the body and bring disease, and how these organisms work. Which then comes pathology. Pathology, either being related or not to microbiology, pathology essentially is how the body is messed up, how the body has a disease, how disease progresses, and how it works, etc., etc. Which lastly comes to pharmacology. Pharmacology basically is what we can do as physicians, as everyone in the medical field, with a medication, with a drug that can aid and manage or cure that pathology. And finally, we have biostats. Biostats, let's say, is the study of, in this case, anything and everything that has to do with the medical field, but instead of an individual, which you will be working with a patient, this is an entire population. So now the question is, how do I prepare for this big change? Unfortunately, to my knowledge, there is no particular way of preparing yourself beforehand for this change in academic workload. However, what you can do is try to focus on avoiding burnout. So what can I do to avoid burnout? Well, you'll be studying long hours and stress will come. I'm not going to sugarcoat it. However, what you can do and start developing is a good sense of organization. That is key. And what does good organization mean? Well, you can start by just having an agenda. Anything. It can be on paper, it can be a virtual, and having a calendar with you. Have everything settled, appointed, and structured in a way that you understand and it's sufficient for you to work through it. Have discipline. Develop the sense of discipline. Do not procrastinate. It will cost you. So follow through on what you need to do. Take breaks. Studying long hours takes a toll. So what I would recommend is you divide your study periods and set to 2 hours with 10 or 15 minutes break in between. Get good sleep. that I can't emphasize this enough. So I know you will be studying, and as a former medical student, I know, and you will be studying late sometimes. But the more you do it, the more you stay up late studying long hours, the less hours of sleep. And the less hours of sleep you get, the closer you might get to burnout. So ideally, you should sleep 6 to 8 hours a day. Avoid excessive nightlife. I know college is super fun and great nightlife. However, when you start medical school, too much nightlife is detrimental to your studies. However, it's okay to go once or twice a month for something just chill or more relaxed, like a cup of wine or just a beer with a friend, but nothing too excessive. And remember, you need to get some sleep. And we all do. It's also okay to party hard for once in a blue moon for a particular special occasion or celebration or anything like that. However, do not overdo it, because more nightlife means less sleep, more hangovers, more alcohol, which is again detrimental to your studies. Avoid distractions. We all get distracted from time to time. However, too much distractions of whatever means won't let us get anything done. Anything can prove a distraction. Friends, family, relationships, sex life, whichever it is. However, as a future medical student, you need to know how to balance these. Now, since I know the phone is probably your biggest distraction, there are two applications that I recommend. One's Flipped and the other is Forest. Personally, I have more experience with Forest because it allows me, one is much more visually pleasing, and two, it's much more user-friendly. In addition to the fact that it allows you to connect with other classmates with a paid version, to be able to support each other in that sense. It's okay to say no. People outside the medical field may or may not understand the kind of pressure you're going through in your career. You chose this, so your studies are your priority. Great things require sacrifice in life, so it's okay if you from time to time need to say no to stay focused on your studies. Eat healthy and meal prep. I know it sounds like a hassle, however, it'll prove incredibly beneficial in the long run. It would only take 1 or 2 hours in a single day of the week, saving you time on a daily basis instead of going out and wasting time to go out buy food. Also, it would allow you to have control of a more healthier diet, and needless to say, it will save you a lot of money in the end. Have a hobby or a sport. Staying active, going to the gym, or having a sport is great for your overall health. However, if you're not into sport, definitely have a hobby. This is because a healthy activity that you do several times a week will help you distract and not let stress overcome you. Avoid stimulants and unprescribed drugs. Use of medications such as, for example, stimulants may lead to addiction down the road and/or adverse or even harmful effects on your overall health. You should not use any sort of drug or medication to enhance your performance. Use of these medications and drugs without the supervision or prescription of a physician can potentially be detrimental to your health. Which brings me to my next point. Take your health seriously. Regardless if you suffer from a condition or not, take care of yourself. It's very important. Don't try to diagnose yourself. If you feel something's wrong or something serious is going on, please go see a physician and get it evaluated. And along with overall health comes mental health. Mental health is of vital importance not only for your performance, but also for your overall health. I cannot emphasize this enough. If you, for any reason, feel retracted, feel some symptoms of depression, constant feelings of sadness, or any thoughts of harming yourself, or any sort of thoughts like that, please reach out to someone. There shouldn't be any sort of stigma. Everyone needs help if it comes to be. Finally, take care of each other. Yes, you will probably as a medical student be competing down the road for residency spots and residency programs. However, through this journey, you need to take care of each other. Above all, your colleagues. Once you graduate, regardless of the grades of your performance, everyone's MD or DO has the same value. So please, this is a long journey. Please be there for each other. Have your back, support each other, be there for each other. We're all humans. And as a future physician, you are training to take care of patients and other people who are in need. So if you're training for that, why not start with each other? I know many of these things you won't be able to do them every single time and every single moment. However, the more you do it, the more beneficial it will be on the long run for you. So this is it for this video. If you have any questions or comments, please leave it in the comment section down below. Please don't forget to leave a like and subscribe, and I wish you all a happy and healthy life. I'll see you in the next one.